The big problem that we are coming together to address today are striking disparities in maternal and child health, morbidity, and mortality, particularly as it relates to our Black birthing mothers.
Our outcomes for Black families are among the worst in the country and the worst in our community. We're more at risk for maternal mortality, morbidity, and infant loss.
Families are losing mothers, sometimes at the point of birth, or birthing mothers are facing life-threatening complications at the time of birth.
Not only can we address the maternal health disparities that impact communities of color and marginalized communities, but we can address the fact that the way that we do birth in the United States today is not working well for anyone.
We don't want living to be all that our mothers come out of their birthing experience expecting. We want to improve the health of our birthing families, and particularly focusing in on maternal health outcomes and health experiences.
We tend to think about health during pregnancy, but it's important that we think about prevention and health promotion at all stages of a woman's life, starting from birth and from infancy. That really sets the course for our lifelong health.
It really feels like there's a synergistic movement towards actually getting stuff done, and we can only do that collaboratively by helping each other and working in tandem.
We can't solve any of these challenges alone. It's not just one person, one organization. It really is going to take a village. Our data, unfortunately, shows that we have a lot of challenges in our community, and these are things that we need to solve today, not tomorrow, not 10 years in the future.